and welcome to the Melanin Initiative. In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language that you can understand. We create a safe space for you to ask your questions and share our nursing perspective without taking too much of your time. Today, we're joined with our returning guest and our favorite trauma therapist, Kelsey Wilson. She's a licensed clinical social worker, and she's here to discuss a new service that she'll be offering in her practice called cognitive processing therapy. So today we're going to learn about cognitive processing therapy, or CPT, what you can expect during a CPT session, how you can select the right intervention for you, the benefits of extended sessions, treatment recommendations, and how you can prepare for a cognitive processing therapy session. If you're new here, once again, welcome to the Melanin Initiative. I am Geraldine and one of your co-hosts. I'm joined by Kimberly and Alicia. And then Kelsey is here, of course. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about the ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. By watching on YouTube or listening on your favorite podcast app, we hope you feel empowered to ask your questions, educated on how to manage your health, and confident to navigate the healthcare system. If you haven't done so already, please subscribe so you can be notified when we release a new episode. Thumbs up the video or leave a comment or two. It helps us help you. It also shows YouTube the content is valuable and helps us to make sure that YouTube shows our content to those that really need to hear it. And as a reminder, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency, you can dial 988. So let's get the show started.
Welcome back, Kelsey. She's a sister to the show, right? She comes in when she's in town, and she's part of the family. So if you haven't already, go back and watch our other episodes with Kelsey. At this point, you know what I'm going to do, Kelsey? I'm going to start a playlist just for all your sessions, right? Great. And that'll make it easy. So that link will be in the description box. How have you been?
I've been doing so good. Thank you for having me back on the show. I'm happy to be here to talk about such an important topic that I think will help a lot of your viewers.
Yeah, you came back earlier this season talking about MDMR, right? And now we're going to learn about another one, which I'm not familiar with. And so I really can't wait to see what you bring in season 4. And yeah, we've learned so much through Kelsey. She's talked to us about intergenerational trauma. She's helped us to have a better understanding of anxiety, depression, and suicidal ideation. So make sure you check out those episodes and subscribe so you'll be notified next time she appears on the show. So for those who aren't familiar with you, Kelsey, please let us know, what type of therapy practice do you have?
Yes, so I have a private practice for women who have experienced some form of childhood trauma. Also work with women who maybe are experiencing depression, anxiety, burnout, life transition issues. And so that's my practice. I work in person in Reston, and I also do a lot of virtual sessions for individuals who are looking to do telehealth.
Excellent. And so from the beginning, when someone's Googling you, what's that look like to get to a point where they can actually have an appointment with you?
Definitely. So they go to my website, kelseywpllc.com. They go to the schedule consultation link, fill out the form, and within one business day, I'm reaching out to schedule a consultation call, which is a free 15-minute call to determine whether the services that I offer are the right fit for you, or if you need a referral to a different provider.
And is that pretty typical that most therapists offer like a free consultation? Okay, nice. Yes. And this is both cash or private pay or like insurance?
Yeah, so I offer a mixture. I take some insurances, do private pay, then I also work with some nonprofits who will help pay for therapy.
Oh, wow. And that's you reaching out to them, or that's like the patient finding resources to pay for it?
So both.
Oh, wow. Mm-hmm. There's a lot I don't know. Right. And then do you have payment plans or?
So the session, if you're doing private pay, the payment is due when the service is rendered. But if you're working with a nonprofit, then I would bill the nonprofit. Or if you're working with insurance, then I would just bill your insurance and you would just be responsible for your copay.
Yeah, and business is great. At the time of this airing, Kelsey's going full-time into her practice. So that just goes to show you that the services that she's offering are needed in the community and that people recognize her value. So congratulations to you, Kelsey.
Thank you.
You're still pretty early in your practice, and so you should be so proud of yourself.
Thank you so much.
And we're so glad you're out here. I've heard you say your little spiel multiple times now, but it just dawned on me. So you help women. Do you help only straight women?
Work with women of all backgrounds.
Okay, great.
Yes, so if you're interested in services, please do reach out to me. And I also help my clients find providers for their families if they're needing a provider for their child or their husband or their partner or something like that.
Oh, wonderful. And only in Virginia, right?
Yes, I'm licensed in Virginia.
Okay, great. Okay, so let's get into it. What is cognitive processing therapy?
Yes, so cognitive processing therapy, CPT, is an evidence-based practice that is designed to help individuals who are suffering from PTSD be able to overcome the effects of traumatic events that they've experienced. And so a lot of times individuals are experiencing flashbacks, nightmares, difficulty with just navigating life situations that may be triggers for them because of past traumatic events. And CPT really looks at it from the lens of, let's look at what some of the stuck points are and how can we think about those stuck points differently so that you can lead a healthy, fulfilling life that feels good for you.
Awesome. So what motivated you to offer this service?
Definitely. So within my practice, of course, I mentioned that I work with women with trauma, and CPT is a really structured approach to being able to work towards symptom reduction. It's 12 to 24 sessions, which I'll go into a little bit more later, and a lot of people find that to be interesting to them because they want to get to the relief. And so it's a structured approach to being able to experience relief from symptoms in a shorter time span.
So you mentioned that the treatment plan is about 12 to 24 to 14.
So it's 12 to 24 sessions.
12 to 24 sessions.
Depending on the person.
Gotcha. So what is one session like with you?
Definitely. So when someone is first getting started with me, we would do an intake appointment where we would be going through your history, your trauma, what are some strengths, what are some things that you want to work on, develop a treatment plan. And then after that, the first session is really looking at teaching you a few things about trauma so that you have an understanding of what CPT is and how we will try to approach addressing the trauma that you're coming to services for. Then we will assign an impact statement where you would do a write-up of what you've experienced, how that impacts the way that you see yourself, others, the world. And then from that impact statement, we would pull out stuck points that are really standing out in your impact statement. And then from there, we would do worksheets each session. You would get assignments that you would do in between sessions to try to think differently and work through some of the traumas that you've gone through so that you can kind of process that in therapy sessions. And at the end of therapy, when you've reached the 12 to 24 sessions, we would do another statement, impact statement, and see how it differs from the first.
Is this something they do at home, the impact statement?
Yep.
Oh, okay, because we don't want to take up the time, right? That's very valuable time.
I was going to ask, do you usually meet like once a week, twice a week? What is the duration, how frequently do you all meet?
Yes. So for traditional therapy, it would be once a week. And then if you were doing a therapy intensive, it would vary depending on what you select in terms of frequency of how much you would want to be seen, and whether you decided to do, a 90-minute, 2-hour, 3-hour session. And of course, it would just increase the pace of how quickly you would get through the sessions. And some of the sessions last a little bit longer. I'll specifically say like session 4, it can sometimes be broken down into more than one session just because of the content. So that's the case where like an intensive would be helpful because we can maybe get through the material a little bit faster.
And CPT is considered an intensive therapy, right?
So CPT is a model that can be used in traditional and in an intensive model. So it really just depends on what the client chooses and what might be the best fit for your work schedule or your family, schedule that you have going on. But yeah, I do a lot of CPT with individuals who want to just do traditional. And this is a new service rolling out CPT in intensive format.
And by intensive, you mean the hour that you're putting in.
How
Okay,
much
so it's
time.
the time. Okay.
Gotcha.
Okay.
Okay.
Yeah. And so how does someone select the right intervention?
Definitely. So during that consultation call, some people might already know about cognitive processing therapy, and so they might be seeking therapy specifically for that. But if someone comes into my practice and they've previously been diagnosed with PTSD, or I diagnosed them myself with PTSD, that will be an intervention that I might mention if I feel like it's a good fit for you, based off of your preferences and what type of therapy you would want to do. CPT involves a lot of worksheets, and so for my clients who want to do homework, who are interested in homework, CPT is a good intervention. But if you're like Kelsey, I'm not really a worksheet homework person, a different intervention, doing more talk therapy might be a better approach, because you do want to get the maximum benefit out of the intervention, and so you want to commit to doing homework so that you can actually see the results that you're looking for.
Someone recently said if your therapist doesn't give you homework, you need to find a new therapist. Well, how do you feel about that statement?
I feel like it depends on the type of intervention that you're doing, because, like, for instance, we talked about EMDR before. EMDR has one worksheet. It's a Pisces log where you would write down like what you notice in between sessions with your body or your dreams or sensations, things like that. So that one's not as worksheet or homework heavy. And then to some talk therapists, they're okay with you coming into the session, processing how you feel, and like homework would be like a reflection. So you're not doing a write-up, but you're kind of more reflecting on what your experiences are. So I guess you should be getting some form of homework, but it might not be as like writing intensive.
Because I would think giving homework might be trauma for some people.
Very true.
I think the key is to not call it homework.
Yeah, you need another phrase.
Right.
We'll help you come up with that.
So Kelsey, you mentioned, CPT being like the right fit. So like, what is the criteria for someone interested in CPT?
Yeah, so they would need to, it's recommended that you have a PTSD diagnosis to do CPT. Otherwise, looking at a different intervention might be a better fit. And so there's a lot of different trauma modalities that we can explore, and so that's why within my practice I try to like diversify and have like different options for people, so that we can pick the right one.
Is this a growing demand, this request for CPT?
I'm sure it is for some therapists, because I do a wide range of different interventions. Like I have clients doing different things, and so I kind of mix it up. But I'd have to talk with people and see like what's the trend now.
Well, like in your practice, what made you even want to offer this new service? Were you getting more requests?
Well, it's been a mix. I haven't necessarily had more people demanding CPT, because I do a lot of different interventions. I do DBT, EMDR, and so CBT as well. So it really just depends, and all of my treatment plans are person-centered, and so it wasn't necessarily like a uptick in demand. It was just more so like, this is one thing that I offer and it's really effective.
I see. And we've kind of touched on it a little bit. Anything else you want to share about like the benefits of these extended sessions outside of being convenient?
Yes, so a lot of people find that by doing intensives, it really works best for the time span that they really want to spend on therapy. A lot of people find intensives to be helpful because they maybe tried other therapy types, and it just hasn't proven to be as effective for them, and so they want to try something different. And also I do adjunctive therapy, so some people might be working with a talk therapist on something else, and they want to come to me specifically for trauma therapy, and so they might just come to me to do CPT work, and they're still going to their talk therapist to talk about other life things. So that is an option. So if you're a therapist watching and you have clients that you want to refer who are doing talk therapy with you and you want them to do CPT with me, please do go to my website and submit a request, because I have a button that you can check to say you're a therapist looking to submit a referral.
What about primary care? Can they send you referrals?
Definitely.
Oh yeah, we don't want to leave anybody out.
Right.
We love to go see your primary care provider.
Yeah, we're real big fans of promoting primary care.
Yes. So you also mentioned previously that on average it's about 12 to 24 sessions. So what other treatment recommendations are there in regards to CPT?
Yeah, so in terms of other recommendations, I would say just kind of going through the process of understanding that it might take some time to work through CPT. So for my clients who are going through the process and might notice that they need a little bit more time than the 12 to 24, that's totally okay, because sometimes it's not just one trauma that someone's gone through, especially if they've gone through like childhood trauma or sexual violence, or so a lot of veterans use CPT, and so they've experienced like more than one trauma in their lifetime. And so when you write your impact statement, you're kind of looking at themes that kind of relate to past traumas that you've gone through. And so of course, when we've had like multiple traumas that we've gone through in our life, it might take a little bit of time to kind of work through some of these things. And so I just kind of encourage people to have like patience with themselves, give yourself grace, and let your therapist know if something's not working for you, so that we can make adjustments.
So when you mentioned this 12 to 24, so like
that's an average.
Okay, so in terms of like pricing, right? Am I paying for 12 or am I paying for 24? Like, how does that work?
Yeah, so you pay for each session that you attend. And so, if you're utilizing insurance or you're doing private pay, it would just be a matter of like each time you go to your therapist, they would bill you for each session that you receive.
You're just kind of giving me managing my expectations, right? Okay. And then I hear you say talk therapy and trauma therapy. You do both? Okay.
Yeah.
But is that everyone doesn't do both?
So not everyone will do talk therapy if they're specifically looking for something like EMDR. They might.
I mean, it's from a clinician standpoint. Like every therapist doesn't do trauma therapy, because you keep saying like go see a trauma therapist.
Yeah. So trauma therapy is like a specialization. So some talk therapists focus on other areas that aren't specifically related to trauma. They might just solely focus on clients who have depression, and it might not be like trauma focused therapy or OCD, and that's what they do. And a lot of people who experience OCD might have had a trauma that triggered the OCD symptoms. But it just really depends on what type of therapist you go see and what their specialization is.
I don't think we think about mental health in the same way as we're thinking of like physical health. So like when you have a heart problem, you go see a cardiologist, right? If you have kidney problems, you go see a nephrologist. But it sounds like you're saying something similar with like, mental health services. If you're having a certain mental health, PTSD, you should probably see a certain type of therapist. Maybe you want to talk to someone. Maybe you don't have a specific trauma you want to work through. You go see a certain type of therapist. So it sounds like, there's different types of therapy depending on the type of mental health need that you have at the time.
Definitely.
But if you're new and you don't know, where should you start?
Definitely. So I would say going online to research your specific symptoms. And I know that can lead people down a rabbit hole.
Like what symptoms are we talking about? Like sleeplessness, anxiety, worry.
Definitely, yeah. So if you're
anger,
big one. And that would kind of help you to kind of decide, okay, what type of therapist should I be reaching out to? If I'm having like anger issues, maybe I should reach out to a therapist that focuses on anger management, distress tolerance. Maybe I want to work with a DBT therapist, a dialectical behavioral therapy therapist, who can help me with managing my emotions. And so then you would go to different therapy directories to try to find someone that specializes in that area. And I also say that, a lot of therapists out there, if they have someone on a consultation call and they're not the right fit, they will refer you. So you can get to the right place. And also want to encourage people that if you start therapy with one particular therapist and it's not the right fit, don't get discouraged. Sometimes, working with a therapist is like trying on shoes. You have to try it out and see if it works for you. And if it doesn't work for you, then please do try again.
I think that's a huge barrier to care, because I'm already hesitant to start. Now I'm starting, just like dating, right? I've spent money, I've paid for parking, I've told all my friends about it, and it's not working out. I'm just going to go back do Netflix and chill, because I know what to expect there, right? And so with therapy, it's kind of like now my emotions are involved, I'm anxious about it, I'm nervous, I'm scared, it's not working out, I'm spending money, right, that I don't have, and it's not working out. And I think that's a huge barrier to care, to say, well, just keep trying. Like, how long should you keep trying?
Yeah, so I would say, sometimes people will start working with a therapist and then they learn through working with their therapist that they have a diagnosis that their therapist may not be a specialist in, and so they need to see a therapist. It's kind of like going to a primary care doctor and then they learn that you have a special condition that you need to see a specialist for. And that's the way that I would frame it, so that you don't feel like it's a waste of time. It's more so like, I needed to discover this one thing about myself so then I can move to the next step.
That's very good, Kelsey. Very good. Yeah, I like how you phrase that.
Yes.
Yeah, so how should someone prepare for this?
Prepare for therapy?
Well, for CPT.
Oh, for CPT. So really just doing a reflection with yourself and say, like, what type of therapy am I looking for? Am I looking for trauma-focused therapy in a structured modality like this, where it's going to be 12 to 24 sessions and I'm going to have some homework assignments that I need to do to try to get me to feeling better? Or do I want to go more so the route of doing a different type of therapy where it's more talk-focused, and there might be some homework assignments here and there, but it's more focused on like verbally expressing myself? Or do I want to do a more non-traditional therapy that doesn't necessarily focus as much on talking, but doing something like EMDR, where you would do taps, sounds, bilateral stimulation to try to reprocess trauma? So there's a lot of different options out there. And so the first part is doing some research to see what you might like. And even if you try something and it's not the right fit, try something else.
And that free 15-minute consultation, it can be really helpful, right? Especially, I mean, money's tight, right?
Yeah.
And so people really are being conscious of how they spend their coins. But if they realize, like, this could be a good match for me, I'm willing to try it, that 15 minutes could really be the thing that helps them, like, take that first step.
Definitely.
Yeah, and we've mentioned EMDR a couple of times. If you haven't watched that episode, go back and watch it, and we'll put that link in the description box. Anything else you want to let the audience know about CPT or how to connect with you?
Definitely. So if you're looking to connect with me, please visit my website, kelseywplc.com, to schedule a free consultation call. You're also welcome to follow me on Instagram, Kelsey Wilson PLLC, and also on Threads, Kelsey Wilson PLLC, for more information and education on trauma and mental health.
Fabulous. And you're on Reston, right?
Yes.
So if they don't want to do telehealth, but they want to meet you in person, they can see you in the Google building, right? Impressive, Kelsey. I'm impressed. So just to any ladies, did you have anything else you want to add about CPT? Okay, so today we talked about cognitive processing therapy, what you can expect during a session. We spent a lot of time talking about how it's different from other types of therapy, and it's primarily for people with PTSD or post-traumatic stress disorder, right? How you can select the right intervention for you, the benefits of extended therapy, treatment recommendations, and how you can prepare for your session, which is really kind of doing some of the work at home, and then you'll come and see Kelsey and she'll give you some more work to take home. Remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel. If you're watching us on YouTube, there's a little, depending on, YouTube changes all the time, but at the moment there's a bell or there's the word subscribe. You can click on that. And so every time you log back into YouTube, especially if you actually log into YouTube, every time you come in, you can see on the side your subscriptions will either appear on your homepage if we have a new episode, or when you go to your subscriptions, you can find us there. And you can hit the notification bell so you can be notified directly when a new episode airs. You can follow us on every social media platform except Threads. We're not on Threads.
Not yet.
Say hello in the comments when you get there. Leave a message or two. It really helps support the show. It shows the algorithm that this is of value, and it'll make sure people just like you will get notified of this message. You can find us on all our links will be in the description box, and any resources that we mentioned today, as well as how to connect with Kelsey. We release new shows like this where we're talking about different healthcare topics on Tuesdays for TMI Tuesdays at 10 a.m. And as you've noticed this season, we rolled out a new kind of professional series where we help to promote different career options in healthcare. Those shows air on Sundays at noon. I think that's all we have. So thank you, and by the way, you can check out our merch store. You can get our new t-shirts, and you can also support our community initiatives by subscribing to our Patreon. Our current initiative at the time is to get enough funding so that we can purchase at least 25 blood pressure monitors. We really want to go into the community, speak to students, tell them the importance of primary care, and before we leave, teach them how to check their own blood pressure so they can take that information home, share it with their family, and save lives. lives. As you know, if you've been a subscriber, and you should be, that the reason this show started was because of high blood pressure and the lack of understanding in the community. And so it only makes sense that that's how we make our debut into the community, is to help teach people how to measure it, why it's important, and if anything, we can just help prevent some of the complications associated with high blood pressure, because it is often a disease that has no symptoms, and that's why it's called the silent killer. So thank you so much for tuning in. Thank you everyone for your participation. We'll see you next time. Thank you so much for watching.
Thank you. Bye.